Hello, I'm Oakley Jordan, and I'm here to talk to you, and I thank you for looking in on me and tuning in, because I think you'll appreciate what I have said after this next few minutes. I'm Oakley Jordan, like I said, and I'm a baby boomer. I'm a baby boomer. I'm one of the 76 million baby boomers. And why do I mention that? You'll understand in a minute. Why I'm talking to you is because not only am I Oakley Jordan and a father of three, but I'm a doctor. I'm an internal medicine doctor, a primary care doctor. A primary care doctor for over 31 years, even though I did graduate from medical school at the age of 11. Not quite, but that's what I tell people. And why I'm talking to you tonight is because this is of a very, very critical nature, and it concerns everyone viewing this right now and listening to everything I say. It has to do with the health crisis. And it is a real crisis, one that's not only at the front door, but it's already in the house, cluttering up everything. And the problem begins with our aging population. That's a good problem, but you've got to understand that 76 million baby boomers are getting ready to go into Medicare starting in 2010. There are 44 million recipients right now of Medicare. The Medicare system, if you don't know, is the system that the government pays for those that are either disabled or 65 and above. When Medicare started in 1965, there were less than 10 million people in the Medicare system. Today there are 44 million. At that time there were about 8 to 10 taxpayers contributing to every Medicare recipient. And at that time, the government only thought that they were going to have to pay for 4 or 5 years of life expectancy up to 69 or 70. Boy, how times have changed. Right now you can expect 20 more years. You've got 3 taxpayers paying for each recipient, and there are 44 million, with 76 million baby boomers getting ready to join in. It's thought that in the next 10 years, the number of 85-year-olds will double. And in the next 20 years, the number of 65-year-olds will double. Well, let me tell you the problem. The problem is that, yes, everybody needs some universal health. To have no one be able to get health care is horrible. But the problem begins with primary care. What is primary care? For those that you don't know, it's the family doctor. It's a guy like me, internal medicine or family practice specialist. Understand this and hear this well. When I finished up, 19 to 20% would go into family practice, internal medicine. Today, 2% of the medical graduates are going into general primary care. In a recent study, almost 1,200 medical students, 24 were doing primary care. That's your mom and pop. That's your family doctor. That's the one you count on to communicate, console, talk, and organize, and keep records of you. The scariest thing, in the last 10 years, the number of primary care number of primary care doctors has been cut in half. Half. Now remember that. 10 years from now, when there are twice as many people over 85, if this trend continues, there won't be 24 out of 1,200 medical graduates. There'll be 12 medical students graduating to go into general primary care. That's not enough. That is what is killing us right now. Also, when you don't have primary care doctors, you end up in the emergency room. For instance, in the last 10 years, the emergency room uses have doubled. Doubled. Basically, you can expect in the last year, for instance, the emergency room visits have gone up from 35 per 100 citizens to 39 per 100 citizens. So out of every million people, that's 40 million emergency room visits a year. And that's very costly and expensive, because emergency rooms are costly and expensive. Health costs going up, waits for emergency room visits longer, and the frustration of not having a primary care doctor is tremendous. Right now there are 50 million people that don't have the quality primary care coverage that they need in this country. And it's going to get worse. It's going to get worse because we don't emphasize primary care in this country. Countries all over the world that have quality health care and low health cost emphasize primary care. We don't emphasize primary care. We emphasize subspecialists. An average Medicare patient will see 5 subspecialists and 2 primary care doctors in a year. I see it all the time. A person come in to see me for the first time, and I say, who's been your regular doctor? Well, I go to a neurologist for my headache, a gastroenterologist for my heartburn, and a cardiologist, heart doctor for my hypertension. People, that's expensive. We need to get back to pushing and emphasizing primary care. Nurse practitioners are great. Don't get me wrong. I'm a big advocate of nurse practitioners. Know them, love them. Can't do without them. But nurse practitioners can do about 70% of what internal medicine could do. So if you have nurse practitioners on your front line, that's 70% of what used to be on the front line. That's a big margin of error. That's a lot of possible misdiagnosis. That's a lot of prolonged care, which adds up to expense and people that are unhappy. And unhappiness is a big thing. You know, people right now watching me might only be 25 or 35, but it will get to you. Because if something's not done, the government can't fund this, can't fund it. But instead of complaining about the doctors being so bad, we need to emphasize primary care. Doctors aren't any worse than school teachers. You got bad school teachers, architects, engineers. Doctors are good people. But it's very frustrating now. In primary care, the reason people aren't doing primary care is because of the frustration and the stress and the paperwork. And to be honest with you, there are no role models. In a recent study done of 250,000 doctors, December 8th of last year, 12,000 people responded. Let me tell you, that's pretty good. You send 250,000 doctors an invitation for a free meal, you won't get 12,000 at that free meal. So 12,000 respondents was good. 60%, that's right, 60% said that they would not recommend medicine to anybody to go into. Now understand that. That's like the majority of engineers saying don't go into engineering. Architects, don't go into architect. That is a tremendous. Where are our role models? Where are our role models? We can't invent them. The government can't make people do that. They can't make you love Aunt Joe and Uncle Tom and Aunt Nanny and have that relationship that we need in primary care. You know, I beg everybody out there that's listening to me that this is a crisis. This is a major crisis. And yeah, you might not be a baby boomer, you might be a late bloomer, but trust me, what affects the baby boomers is going to be double worse for you. So the time is to act right now. Yeah, we need uninsured to be taken care of. But I'm going to tell you something right now. If we don't fix this primary care problem, and there's a major problem, check with your local medical societies. Check with your local doctors. Call your congressman. Write them. If we don't correct this, this universal health plan is going to have waiting rooms packed with nobody to see them. What good does it do to get an appointment and sit in a waiting room and be seen by lesser than your father and your grandfather were able to see? So what's the solution? The solution is, number one, write your congressman. They've done some statistics, and for every letter written, you have 300 people that think the same way. Boy, that's great. Think about it. 300 for every one letter. Write your congressman. Don't listen to this and don't do anything, because there's an old adage. You don't know what you had until you lost it. And if you lose primary care, if we wait 10 years, where twice as many 85-year-olds are, or 20 years, where twice as many people are over 65, and you only have 8 medical students going into primary care, who's going to be there for you? I want to be there for you. I love primary care. I'm one of the few that wouldn't do anything else. But I'm worried, I'm concerned. I've done this for over 30 years. I hear what the doctors are saying. We all want to keep being doctors. Call your congressman, write your congressman, call your medical societies. Please, call.